So today's presentation is all about clinical growth, your growth as a clinician, and how to use your training and consulting and even supervision effectively to improve your practice. And part of the inspiration for this was when I worked on a first team as a provider, I was always striving to do the best work that I could do. And now that I do CBTP consultation with first teams, I'm thinking a lot about how to help people on those teams get the most out of our consultation time and how to help them be more effective. So today we're going to review some learning strategies to improve your practice of CBTP, review some core components, and then talk about how to develop strategies for utilizing supervision and consultation to help improve your practice. I want to open with a question. How long does knowledge about psychology stay current? Think about that question for a second. Feel free to type your answers in the chat or just think about it to yourself. Um, but an intrinsic part of being a helping professional is our responsibility to learn a body of knowledge about people, how to understand and work with their thoughts, their emotions, their behavior, with their family systems. And then we try to use this knowledge in our work to help them in their efforts to change. But learning is not a static process. And so in thinking about the answer to this question, I want to invite you to think about where you're at in the process of learning. All right, hopefully we have some answers in the chat. I'll give you 2 more seconds to think. So what we know from research is that psychological knowledge stays current for about 6 or 7 years. And for some specialties, that length of time actually decreases to 3 to 4 years. So that means if you work for 25 years in a helping profession, this means that you'd have to refresh your body of knowledge about 3 to 4 times over the course of your career. Staying current in any field is challenging. Learning anything involves a commitment of time and energy, but it's important that you take that commitment seriously because the quality of your work really depends on it. There's multiple ways that therapists and other practitioners learn. So I'll give you a useful analogy here to think about your learning experience. Think of it as a stool with 3 legs. Each leg represents a source of knowledge that is derived in a very specific way. These legs are the academic research and theory that informs your practice, your experiences as a practitioner actually working with people, and then your own personal experiences or lived experiences and your reflections on that. The legs of this stool roughly maps onto a model of therapist skill development called the DPR model. It describes 3 systems by which we learn: declarative, procedural, and reflective systems. But the important thing to know about this is that there are 3 legs. And to remain balanced, it helps to pay attention to all of these aspects of learning and to ask yourself which are stronger and which are less strong for you. So a little bit more about these 3 legs. Learning is a process that evolves over your career. And in the early stages of a practitioner's career, there's more emphasis on acquiring knowledge and on learning when and how to apply that knowledge. Gaining knowledge alone is not sufficient for becoming a better practitioner. When you learn, what you learn can become inert or inactive if you don't actually use it in the real world. Experienced therapists also have to learn about how to apply what they learn. That's the type of knowledge that people get from just doing it. But then what really distinguishes expert practitioners is the reflective component of learning. Self-reflection involves observing and evaluating yourself, being aware of your strengths, your limitations, and your biases. It's all a part of self-reflection. And this reflective component is usually something that takes on a larger role as you progress to later stages of your career. But regardless of which stage you're in, all of these components are operating and they're all important to consider as you develop your skills. Think of learning as a continuous process that integrates all 3 of these systems. The experiential learning cycle that you see here is one way these components are integrated. It shows how you might move from introducing a concrete task to reflectively observing on the results of that task, to conceptualizing what you've learned, and to actively experimenting with a strategy based on what you've learned. These are the building blocks of the learning process. So for example, if you're working with somebody who has paranoia about being followed, you might first try to explore evidence with that person for his paranoid beliefs. Then you might reflect on the encounter that you had with that person, and you might realize that you found yourself trying to persuade that person that his paranoid belief was not correct, rather than allowing good Socratic questions to lead him to that conclusion on his own. In response, you might take this reflective observation back to your supervisor or to a consultant, and you might practice different ways to approach paranoid thinking using the principles of guided discovery rather than persuasion. And then through this practice, you might come to understand that you need to use more empathic listening, and you might need to increase your use of summaries in your sessions. And then you might develop ways to use these insights the next time you meet with this person, a really concrete way to apply that learning cycle to a specific problem. As you develop, you're going to be faced with the task of deciding where to focus your energy. What should you learn? There's a plethora of approaches to learn, and it's impossible to learn everything that there is to know. One way to focus is to direct your attention to approaches that are evidence-based and which have direct applicability to the population you serve. Once you identify a model, then you can learn it inside and out. And for those of us who work with psychosis, cognitive behavioral therapy for psychosis is a natural fit. It's an approach that's evidence-based and it takes time, but it's something that you can improve on in your practice. So knowing and adhering to the core components of a psychotherapy model like CBTP is important, but psychotherapy is inherently human in an endeavor. There's art to how you apply it. So I'm going to use another analogy here. Think about cooking. If you're preparing a certain dish, there's a recipe for making that dish. The recipe outlines the ingredients you need to use, but not all of the ingredients have the same value. Some ingredients are essential to the dish, while others can be used a little bit more flexibly. In the same way, a model like CBTP has key ingredients, and it also has other ingredients that you can play with. For CBTP therapists, one critical objective is to learn the core components of CBTP and apply them with fidelity, but while also allowing some room for creativity with those components that are not core to the model. What are the core components of CBTP? Well, the list on the left are competencies that are measured by the cognitive therapy scale, which was developed by Aaron Beck and his associates. It's the most widely used general measure of therapist adherence and competence in CBT. On the right is a list of CBTP specific competencies. You'll notice that the NACBTP standards require the therapist be competent in the generic model first, but with the added psychosis competencies. So for instance, there's an emphasis on adopting a recovery orientation during your engagement with people, using normalizing to reduce stigma of psychosis, understanding cognitive formulations for hallucinations, paranoia, delusions, negative symptoms, and thought disorder. The CBTP clinician needs to be familiar with these competencies to use them effectively. Many clinicians find out that learning CBT presents us with some challenges. It's normal to encounter barriers. We're all imperfect. We all make mistakes. We all have bad days, but knowing these barriers can help you become aware of them. So I'd encourage you to look at this list and think about the areas where you encounter difficulty and then make a plan for addressing it. So as a point of disclosure, I'll share that I still struggle with incorporating homework into my sessions with clients. And since this is an area where I struggle, I've been trying to make a deliberate effort to address that in my practice. Learning CBTP also involves learning more than the generic CBT model. So we mentioned before, there's lots of different models of psychosis symptoms, and they can be complicated. When researchers in academic settings develop these models to explain things, they're trying to be as comprehensive as possible. That's what academic settings often emphasize, which is rigorous analysis over practical utility or realistic application. And this can make learning models feel very overwhelming, especially for people in community-based settings. But many trainees want to develop more simple formulations with their clients. It helps their own learning, it helps their clients understand things. And this is where the concept of flexibility with fidelity can come in handy. We can simplify things so that they're easy enough to understand and apply, but we don't want to oversimplify to the point where we lose those core components. And this is a tricky balancing act that we all face. How to use research to inform our practice. And so in practical terms, how can we improve our clinical skills? Well, the first thing I'd encourage you to do is just to become an active participant in the learning process. Therapists often like to get very specific answers from their supervisors or consultants, but one thing we know is that true growth comes from wrestling with difficult problems and actively generating solutions on your own, using your own thinking and your own reasoning. Supervision and consultation can be a great way to clarify your thinking and get support as you enhance your skills. But the growth starts with you. To get the most out of it, out of supervision and consultation, it can be helpful to think of specific questions or issues to discuss. This can be challenging for a lot of reasons. There can be a real sense of vulnerability when you seek out feedback or admit that you don't know what to do next. I've felt that myself. Um, but it's by embracing that vulnerability that you can really uncover the gaps that you have and improve your practice. And it can be really helpful to review the common barriers that people who are trying to learn CBT need to be aware of, the ones that we mentioned earlier. And then seek out opportunities for active learning through role plays, live observations, fidelity reviews. I'll say that when I was learning another modality of family therapy, one of the most valuable things that I did was I completed an externship where I had a consultant watch live while I was doing that form of therapy with the family. That was so invaluable. There's just nothing that can replace that. I'd encourage you to pursue the same thing. Now, here at NEOMED, we're in the early stages of really formalizing a skill development pathway, which is our process for fostering clinical growth of people who attend our CBTP Foundations course and who want to become expert CBTP clinicians. And so if you're interested in learning more about this, feel free to reach out to us. You might have seen this graphic before in other trainings, but it really follows that same DPR model of development. And so in the spirit of reflective practice, I'm going to ask you to think about these three questions again, the ones that I mentioned earlier. Which legs of the stool are the strongest for you? Which are weaker and need to be reinforced? And what plan do you have to improve your therapeutic skills? Just think about that. And by answering these questions, you can create a plan that will enhance your growth and your development as a clinician. And so I'll just take a minute here to see if there are any questions or comments or thoughts. I'm not monitoring the chat, so feel free, Danelle, to pitch that to me if you see any.
Nothing so far.
Okay. By the way, we are looking for case presenters next month, so I'd encourage you to think about whether you want to present. This is a good way to engage in that learning process. Sandy Panovich is the person who receives the cases. We have a really cool case this month, so take advantage of that if you can.